Regen-Cov is a monoclonal antibody, which is an antibody that's made in a laboratory, and it's injected to our body whenever the patient has mild to moderate COVID-19 infection. The way it works is by binding to the spike protein, which would then latch onto our cells and infect us with the virus. Currently, they are FDA approved for emergent use on patients with COVID-19 that present, and they meet criteria such as having a BMI greater than 25, having pre-existing conditions such as heart disease, hypertension, being diabetic, older than 65 years of age. The medication has been shown to be extremely good for people who have mild to moderate disease with COVID-19. The recommended window for treatment with the monoclonal antibodies or Regen-Cov is going to be anywhere from 1 to 10 days after the diagnosis. Once the patient meets admission criteria, that is, their oxygen drops below 92, or there are inflammatory markers that are extremely elevated, or the patient looks very sick, or has bad infiltrates on the CT scan of the chest or the X-ray, then we are not allowed to give them the monoclonal antibodies. There are adverse effects to everything that we can use in our body that doesn't belong to our body. Mainly, it's going to be pain to the injection site. Also, a person can develop a rash, or they can develop an allergic or anaphylactic reaction. For this reason, once we give the medication, we keep the patient in observation for several minutes to ensure that if they were to develop this kind of reaction, we can treat them. I recommend that everyone that feels like they're having any of the symptoms, that said headaches, nausea, diarrhea, sore throat, runny nose, cough, to seek medical care as soon as possible and get tested. There are several COVID-19 tests that we could be using, mainly the antigen and the PCR. The one we recommend the most is the PCR because of its accuracy. So as a general rule, if you're having any symptoms or any doubts, if you were exposed to COVID-19 and you want to get checked, please come by. We have all the tests to test you for the COVID-19. Results are usually done by the same day. And if you're positive and you meet the criteria for the administration of the antibodies, we can give you the antibodies as well.